This Health in Focus is a paid segment by Jagannathan Neurosurgery.
Today we're talking neck pain. We have board-certified neurosurgeon Dr. J. Jagannathan here with us. Dr. J, why is neck pain something that is so critical, and when we have it, we really need to pay attention to it?
The neck obviously is what connects the head to the rest of the body, and because of that, because it's a mobile structure in between two fairly rigid structures, meaning that the skull and the thoracic spine don't move as much, it undergoes a lot of stress. Anytime you turn your head, you drive your car, you look at the computer, you're putting stress on various points of the neck. And because of that, in most patients, especially active people, you get arthritis in the neck, and that oftentimes leads to pain. The reason it's important is because the nerves that travel down there supply the rest of the body. And because of that, injury to those nerves can have very serious consequences. So it's something to catch early if it's an ongoing problem that's not improving.
Is neck pain a symptom sometimes of some more serious issues you're dealing with?
It can be. It's anytime you have arthritis or nerves that are pinched in the neck, it's always a concern. Obviously the nerves that control the arms and the legs travel through the neck.
Yeah.
So those are all susceptible to injury if disease progresses. The other thing, as I'm sure Mr. Weicker could talk about, is things like headaches and pain in the back of the neck are not unusual when the discs get degenerated because it puts extra stress on the muscles and the tendons in the back of the neck. So those are all things that can see, and they can be extremely debilitating. They can be to a point where it can prevent you from functioning normally.
Yeah, and we have one of your patients here with us, Dennis. You were suffering from pretty bad neck pain when you first saw Dr. Jagannathan,
Oh,
right?
they were the worst. They weren't so much in the neck, they were up in my head. There was like, they weren't for an hour or two, they were 24-hour
Wow.
pain. It was like half a dozen guys inside my head hammering away, and then maybe also at the same time a cannon going off, and wouldn't have been for him, I don't know. He saved my life.
Wow. How was he able to help you?
Well, he had to do surgery on me. I thought they were going to go through the back, but they cut my throat, went through there. And,
Wow. You're feeling really, really good today, though,
oh,
right?
yes. I haven't felt this good in ages.
Wow. Dr. Jagannathan, I want to ask you, how are you able to help patients like Dennis get back to living their life again?
So in a situation like Mr. Weicker, the disc itself had degenerated and was not only causing pressure on the nerves, but was also not serving in its usual buffering capacity. So what we can do there is basically go in from the front of the neck, and the reason, as he mentioned, the options are going from the back or the front. But the advantage of the front is it provides a more direct access to the disc, and it allows us to open up the height of the disc back to normal. And the advantage of that type of surgery is usually it's an overnight stay, so it's a fairly short hospital stay and a fairly quick recovery. There are some temporary restrictions in terms of lifting and bending, but it does work very well, especially in terms of arm pain and even in terms of neck pain and sometimes even headaches, as you can see here.
And when people are dealing with different types of pain, neck pain in particular, there is a lot of different ways that you can go about helping them. It really depends on their specific issue and their set of circumstances.
Yeah, we always start with the non-surgical, what are called conservative treatments, which are things like the physical therapy, injections, things like that. And usually you get to surgery in most cases when those treatments are ineffective or are not completely effective, or when the symptoms are getting to the point where someone can't tolerate them anymore. So there are a range of treatments, and I think it's always individualized to the specifics of a given patient.
Yeah. Dennis, thanks so much for coming in and sharing your story with us. Dr. Jagannathan, thank you. If you want to learn more about Jagannathan Neurosurgery, we've got all you need on 910news.com.
This Health in Focus is a paid segment by Jagannathan Neurosurgery.